So we're speaking about Therapy Works. And what happens on Therapy Works is that we inform and update the public on different things in regards to therapy and treatment and all like that. And with me this morning is Robyn Edwards, who's a speech language pathologist. And we're going to speak about something in the train of Carnival, because last week we spoke about the voice. This week we're going to speak about hearing.
Yes, and I was very happy to hear Alison talk about drinking all that water, because that is hydrating. That is you know, keeping your voice hydrated is essential, especially for a performer.
And we spoke about that last week. And so on the topic of hearing now. You know, there are different things that can cause hearing issues, but before we go into the issues, explain to me what is like healthy hearing.
So, I mean, healthy hearing is just, it's being able to hear at a certain frequency and a certain decibel or loudness level. Right? What I want to do today, though, is just give you some tips to keep your hearing healthy, right? Especially just like with voice, we talked about overuse. With hearing, it's about overuse as well.
Or rather, overexposure.
Overexposure, exactly. That's
now, I had experience. I was at a fete years ago, and the next day I had terrible pain in my right ear. Only later on to go to the doctor, and he told me that the eardrum was ruptured. Right. So, how common is that in your field? How often do you have patients that experience that?
Well, I mean, so I am a speech therapist, so I don't directly deal with hearing. If you have an issue with your hearing, you need to seek out an audiologist. And audiologists, like speech therapists, like occupational therapists, need to be licensed by the Ministry of Health. So that's very important. Don't be afraid, you know, general public, to ask your audiologist, are you licensed, right? So they probably see that a lot, because if you rupture your eardrum, basically your eardrum is like, it's a drum, right? It's a membrane on the inside of your ear. It's very painful if it ruptures, obviously, and it can cause some hearing loss later on because there's scar tissue that develops. The flexibility of the drum is affected.
And when you get hearing issues, is there any cure that, you know, you could fully restore your hearing?
Well, no. If you damage your hearing is gone. That's why you then end up looking at hearing aids and other devices to provide that hearing amplification, you know.
Oh, wow, well, that's intense. So prevention in this case is much better than cure.
Yes.
So let's speak about some preventative measures.
Okay, so what you should have done in your case is use earplugs. If going to any fete, I mean, I remember as a teenager, and I'm horrified by it now, but standing up in the speakers at fetes, don't do that. That's very, very bad for your eardrums. It's very bad for your cochlea. So wear earplugs. Earplugs are really going to help prevent damage. They lower, again, that decibel, that loudness level, and they help your ears. The other thing that is important is, you know, everybody wears the earbuds now and the headphones, that kind of stuff. You want to turn the volume down, all right?
You know, because a lot of people have the habit of, like, you know, they hear a song they like in their, you know, their MP3 players or anything like that, and you know, they're like, oh, they crank it up.
I mean, it's crazy, but you can follow something called the 60-60 rule, all right? You listen with headphones at no more than 60% volume for no more than 60 minutes a day. So it's not very long. You know, I think about when you stand up on Arpita Avenue or somewhere and you see those cars drive past with the big subwoofers in the back, and, you know, a guy's just listening to this booming music, and I cringe because I just think, like,
for
actively
me,
losing hearing.
I can't relate to it. I can't understand why somebody would put themselves through that if they could actually even hear the music properly. It's all just for show.
And I mean, I think you know, there are a few other tips, but the last most important one is to give your ears time to rest and recover after exposure to a very loud noise or loud music, or, you know.
Okay, so what you're saying is, like, say for instance, in the season of Carnival, you go to a fete, it is very necessary after that vet to have a break, basically.
Yes.
So not go from one vet to a next vet
yes,
and then playing loud music in your earphones.
Yes, it's not like to come home from a vet, crank up that radio loud or put on your headphones. And it's not just music, it's Fortnite, Roblox, all these games that you play now with headphones on, these young kids are being exposed to. It's going to affect their hearing for the rest of their life.
So as we said earlier, prevention is better than cure. I want to thank you so much, Robyn Edwards, speech language pathologist at Therapy Works. We're going to have you all back next week again to speak about some interesting things, maybe still in the train of carnival, and you could keep us informed in regards to that.